everyone, welcome, and thank you for attending this webinar with Dr. Silverman. My name is Michaela and I'm on the marketing team here at FullScript, and we are very pleased to have Dr. Silverman here to talk about how the immune system works and the latest developments for improving immunity. Before we get into the presentation, I wanted to give you a reminder that this recording will be sent to everybody who registered, so if you have to leave early or you'd like to go back and watch it again, you'll have direct access from your inbox. This recording will also live on FullScript's website at fullscript.com/webinars, where you can access all of our past and upcoming webinars. Throughout the webinar, if you have any questions, please add them to the questions section on your GoToWebinar dashboard, and we will get to them during the Q&A period at the end. So again, I'd like to thank Dr. Silverman for being here today. Dr. Silverman is a chiropractic doctor, clinical nutritionist, national and international speaker, and author of Amazon's #1 bestseller, Inside Out Health. He is the founder and CEO of Westchester Integrative Health Center. He has a Master's of Science in Human Nutrition and 5 other designations in clinical nutrition. The ACA Sports Council named Dr. Silverman Sports Chiropractor of the Year in 2015. Dr. Silverman is on the advisory board of the Functional Medicine University and is a seasoned health and wellness expert on both the speaking circuits and media. And with that being said, I'm now going to pass it over to Dr. Silverman to take it away, and I'll rejoin you closer to the end of the presentation for a live Q&A.
Thanks so much. It's my pleasure to be here. I'm excited about sharing some clinical insights on Immune Reboot. I just want to double check that everybody can see my webcam.
Yes.
And are we good?
Yes, we're good.
We're terrific. Thank you. Again, the idea of Immune Reboot really came up approximately over 2.5 years ago, all with the idea of a virus taking over everybody's consciousness. So that being said, I've been working for 2.5 years, really trying to put together some different kind of immune protocols, ideas on immunity, and look at the body in a systematic manner. So this is the culmination of endless hours of study and practical application and practical learning. I do practice in New York. I practice 4 days a week, and I'm usually lecturing on the weekends. Again, I'm excited to be here. I encourage anybody to ask questions. I am going to leave some information, so if you have a question that we can't get to, I will certainly answer it through FullScript. So let's move ahead. Please note that the content is intended solely as informational reference tool for practicing healthcare professionals. The disclaimer, these are my protocols, these are my slides, and if you have any questions, please take a look at this. I have said multiple times, you can't control the virus, but you can control the host. I can't control the virus, I can't control bacteria, I can't control pathogens and antigens, especially my inability to control the virus. I can't control the air, if you will, but I can control the host. I control myself. I can control my friends, my family, and hopefully my patients. This webinar is all about controlling the host and building a better immune system and looking at specifics within that immune system to get a better health outcome with patients, family, friends alike. The immune system is interesting. Most people have talked about the immune system being 2 levels of defense. It's actually 3 levels of defense. And these 3 levels of defense are against disease-causing organisms. Number 1, we have the barrier system. We forget about the idea that we have the skin and the mucous membranes. Our skin does protect us. Obviously, if we get a cut, it's interesting, most people know enough to put a Band-Aid over the cut. But when you look inside the body, stomach acid, digestive enzymes, your digestive tract, beneficial bacteria that live in the colon, the gut microbiota, all are part of your first barrier system. We all know people regurgitate. We all know that people get the runs. Our digestive system protects our immune system from allowing foreign antigens and pathogens to get in. It has been stated that the first time the inside world has met the outside world is when food gets absorbed through the small intestine. Taking it to the next step, we look at the innate immunity and the acquired immunity. It's an interesting fork in the road, if you will. Everybody has innate immunity when they're born. It's a general defense. Your innate immunity are white blood cells called neutrophils, macrophages. I call them Marines because they engulf and destroy foreign invaders and damage cells. Your acquired immunity, or what we also like to refer to as your adaptive immunity, is a specific defense. They're your B and T cells. Your T cells obviously come from your thymus. Your B cells come from your bone marrow. Your T cells memorize a pathogen, and your B cells categorize them. They'll remember them. They'll catalog them. Your T cells are interesting coming from your thymus in that your thymus gland is the first gland to go through involution. It goes through involution in your teenage years and theoretically is useless to many people by age 70. That's why they talk about immune system failure at 65 to 70. Your B cells make antibodies like IgE, which is a allergic reaction, IgM, which is an early antibody, IgA, which is more secretory through the gut and the lung, and IgG, which is the most prominent one, the most popular one. It's 75% of the antibodies. IgG is also small, and it passes through the placenta to get to the child. So the innate and the acquired immunity, it's not really versus like the slide says, it's in balance, it's in synergy. They both have to work well and they both have to be developed. Now, we all know the acquired immunity is something that you acquire during a lifetime, and it's also called adaptive because its ability to adapt to different pathogens. So what does a normal immune response to infection look like? In that, one, we get inflammation. This is normal. It's our body's response. Something new, we may raise a little fever, we may not feel all that well, but inflammation is normal. And inflammation comes and starts with your innate immunity. Your innate immunity then goes to your adaptive, acquired, or your specific immunity. It then hopefully resolves in a perfect scenario. And then you have memory, where you have memory T cells and you have specific antibodies. However, when you look at a viral infection, like a COVID-19, you get this immune response, this new gnarly hyper-infected response to this virus, which can lead to a release of cytokines. Now, the cytokines are inflammatory markers. They're protein enzymes. So a cytokine storm is when you get really sick. A cytokine storm syndrome is when the cytokine release doesn't stop. That also can damage microbial metabolites. It can lead to disease. That disease is also backed by mitochondrial dysfunction. We'll go into why and what that feels like. And many people feel quite poor. They're quite tired, and fatigue being a very prominent symptom of that. Immune response to COVID-19 or SARS-CoV-2, inflammation is too high. The problem that we have in America today is that we're all pre-inflamed. Most of our patient base is inflamed. 75% of Americans is obese or overweight. Most people are inflamed. So it starts too high and it doesn't shut down your inflammation. So now you're elevated. You have less innate immune cells because of your inflammation. You have virulent factors that may not launch with your autoimmunity. We've seen a lot of people that have not had antibody release or efficient antibody release. You're slow to resolve, and you're not really good at making a memory of what occurred. Obesity, the portmanteau of COVID and obesity. We know that people who are obese, as I said before, 75% of Americans are overweight or obese, and I think it's about 40% now people fall in the obese category. Obesity increases your incidence of COVID. Obesity increases your incidence of a virulent form of COVID, getting sick too long. COVID also leads you down a path of obesity because it doesn't allow you to be active. So you put them together, and again, you have that portmanteau called obesity. Pre-infection vitamin D levels. This was something I talked a lot about with my patient base. This was from April 2020 through February 2021, almost a year. It was based on positive PCR tests. These were vitamin D levels. Somebody who had a vitamin D level less than 20, which is quite low. I'm a big proponent of 60 to 80. I know the range is 30 to maybe 100. 30 is too low. 60 to 80 is really the sweet spot. In that the people had a level of less than 20, 14 times were more likely to have severe critical COVID cases than those with more than 40. Just look at the mortality rate. Sufficient vitamin D levels, 2.3% mortality rate, going way back to the Gamma and Delta infections, and deficient vitamin Ds had it up to about 25.6%. So the dramatic change in just a vitamin D level. So I am actually a big proponent of getting our vitamin D levels up, amongst other things, to ancillary allow our immune system to function at a higher level. COVID also caused a lot of long-term effects. I mean, is it long COVID? Is it long hauler syndrome? Is it long haul syndrome? All these mean essentially the same things. But the data was interesting in that it took most people in this study 79 days after getting a positive test to COVID-19 to return to their normal resting heart rates. Tachycardia was a big symptomology. 32 days to get back to your pre-step. So you lost about a month's worth of, which really isn't as long as some people we've met, a month's period of time to allow you to get back to your exercise level. Sleep patterns return 24 days. To me, I believe that that's the most deleterious. The fact that it takes you 24 days to get back to your normal sleep pattern is very taxing on your body. One night can lead you down a path of tau tangles and amyloid beta release. COVID also, a year later, increased your incidence of diabetes by 40%. I think one of the biggest issues wasn't just obesity, was the fact that many people are on a metabolic syndrome path. COVID seemed to attack specific things that raised your diabetes risk quite substantially, to say the least. Here's a telling article. Here's a telling slide. When you compare and contrast to Japan and the US, it was very interesting in that the COVID cases were, this is times, this is not a percentage, 12 times higher in the US than Japan. The death rate was 17.4 times higher in the US than in Japan. Your diet, American diet consisted of 1.5 times more saturated fat, less fish oils, or EPA DHA. The US also consumed more beef, almost 400%, and of course that was grain-fed beef, and sugar and sweeteners were 235%. The average American consumes 160 pounds of sugar per year. They also consume 142 pounds of artificial sweeteners per year. The Japanese, contrarily, had a consumption of fish increasing 44.3% compared to Americans. Rice was 11.5 and tea was about 55%. The prevalence of obesity in American men was 7.4 times greater than the Japanese man and 10 times greater in the women. What's the takeaway here? Obviously, one of the biggest problems we had with this pandemic, and one of the biggest problems in America, is we are just not healthy. We're too heavy, our blood sugar is too high, and the standard American diet, sad, is extremely ruinous to our overall health. So let's talk a little bit. Let's recognize the possible rise in autoimmunity and increased inflammatory status following recovery from COVID-19. Here's a great study in January of 2021 where they studied an immune reaction, a cross-reactivity to the spike protein. The production of cross-reactive antibodies was prominent with these tissue antigens, the GI and the tight junction. As we all know, 80% of our immune cells are in our gut, skin, nervous system, thyroid, joint, muscle, and cellular component. So let's talk about COVID-19 and autoimmunity. Is COVID-19 long hauling an autoimmune condition? I don't know if it's an autoimmune condition, but there could be components of autoimmunity. Where does that autoimmunity come from? Well, number one, autoimmunity typically is in the adaptive and the acquired immune system. Essentially, that cells, when they're B cells, when they're in their extrafollicular stage, have not fully matured. They become fully matured and they're ready for activation in the germinal cells. So the example I use is if it's in the extrafollicular stage, you're like a 15-year-old trying to train to be a Navy SEAL. But when they're in the germinal cells, they're a 25-year-old fully trained Navy SEAL. If your innate immune system is not functioning well and you don't have enough cells, and the balance between the two systems, the innate and the adaptive, are off, you will send your B cells in too early. Those B cells won't be properly trained and they will probably start to attack everything. So essentially what I'm saying is COVID-19, because of needing antibodies too soon, because our immune system isn't functioning, leads us down a path of autoimmunity. So what is the trigger for autoimmunity? Well, there's genetics, nutrition, chemicals, and ultraviolet exposure, but also the gut microbiota and, of course, infection from COVID-19. They go in concert, leading you down a path of autoimmunity. So the development of autoimmune diseases following SARS-CoV-2 infection led you to genetically susceptible human subjects, molecular mimicry. People always ask me, what about molecular mimicry? What does that mean? Molecules that mimic each other. All molecules have a protein sequence. It's kind of like a zip code. Now that protein sequence of antigens like foods, we'll say gluten and dairy, mimics multiple structures in your body very closely. So my zip code where I am is 10605. There's 10601 to 10608. People get confused in zip codes. Your body also gets confused with protein sequences. And when it does, your body doesn't attack just foreign, it starts to attack self and can attack discs, joints, thyroid, brain, etc. So that comes from a hyperstimulation of the immune system, excessive cytokine storm, and ultimately you have autoantibodies produced. So we have antibodies which are good, their own defense mechanism. When we have autoantibodies produced, interestingly enough, they attack our own structures. And that leads you down a path of autoimmune disease and severe COVID-19 disease. UCLA researchers show that 30% of people who were treated for COVID-19 developed something called PASC, post-acute sequela of COVID-19. What I will refer to as either long COVID or long hauler syndrome. So a multi-system manifestation of this PASC, long hauler syndrome, can have neurological deficits like olfactory, gustatory. So people are losing their loss of sense of smell, their loss of taste, headaches, cognitive impairment. Also cardiac and cardiovascular issues, gastrointestinal problems, and that may be first, that microbiome may be first, and we'll share some insight into that in a couple of the succeeding slides. Mental health issues like depression and anxiety, pulmonary issues like cough, pulmonary fibrosis, other chronic complications, kind of like a skin rash, hair loss, etc. Yes, there's been a lot of conversation about hair loss post-COVID-19. Long hauler syndrome. 55% of patients had at least one COVID symptom 2 years later. 6 months after infection, people suffering from long hauler syndrome had 68% of symptomology still present. And now the studies have been in because long haulers was coined by, believe it or not, a Twitter expert in May of 2020. Patients generally had poorer health 2 years later. I'd like to take a moment and just talk about how long haulers was exposed to me. As you know that I practice in New York, I practice in Westchester County. I live 6 blocks from where it all started. So people were sick early here. They were pretty sick. They were seeking out some help, some advice, some things to build back their immune system. So I've been exposed to a lot of people suffering from pain, fatigue, problems with sleeping, and some even mental health. Also in long haulers that I've seen, they had a harder time exercising, and they're experiencing a poorer quality of life. COVID-19 infection has more than 50 long-term effects. I've read some up to 200 effects. More so than that, believe it or not, the vagus nerve has dysfunction in many of the long hauler patients. Vagus nerve, cranial nerve number 10 goes from the medulla oblongata down through the transverse colon. Your rest and digest nerve, your longest cranial nerve in your body. It's a long meandering nerve. And being that it's a rest and digest nerve, when it is decreased in tone, which is very common in many of post-COVID patients, diarrhea becomes a very frequent symptomology. In addition, the vagus nerve has shown in people suffering from long haulers to actually have nerve thickening, and again, that tone is decreased. One little hack, if you will, lifestyle hack, strength training is essential because a lot of long haulers lose muscle. So you want to get them when they can to be able to strength train so they don't lose their muscle. Remember, Tufts University, all the way back in 1998, talked about the first sign of aging was a loss of muscle mass. Global prevalence of 120 days after infection of long COVID was 49%. Global prevalence of post-COVID was 43%. And once again, fatigue is the most common symptom. For what I've seen, fatigue number 1, brain fog number 2, diarrhea number 3. Neurological symptoms persist in a majority of long haulers. 6 months following COVID-19 infection, 2/3 of patients still experienced the neurological issues, which included headaches, memory impairment, and inability to concentrate. Another study showed a total of 62 symptoms were significantly associated with SARS-CoV-2 infection after 12 weeks. This is gnarly, there's no doubt about it. Let's look at some distinguishing features of long COVID. Number one, what you'll see is a tremendous increase in antibody responses. Number two, Epstein-Barr. It's going wild with a lot of people coming in with the long COVID, and in that, 2/3 of them, literally 2/3 of them, they'll see a slide in some of the succeeding slides that really backed it up. Epstein-Barr was elevated, it was reactivated. So as we all know, our viruses can lie dormant for years in our central nervous system. Our central nervous system remembers everything. Our memory, if you will, our cognitive memory sometimes doesn't. Epstein-Barr really increased the idea of fatigue because, as you'll see some of the slides coming up, was it COVID that was the fatigue? Yes. Is it Epstein-Barr fatigue? Yes. Was it the combination? And that's why it was so, no pun intended, fatiguing for everyone. Also, long COVID patients had a decreased cortisol. That cortisol is low in long COVIDs actually implied that there was individuals had an HPA dysfunction. Also, long cortisol is very typical with chronic fatigue syndrome. So many people with long COVID are mimicking chronic fatigue. It just appears to be worse. Impaired exercise in many post-COVID syndromes. 55% of people with long COVID also had abnormal exercise testing results. Patients with elevated blood clotting markers are 4 times more likely to show persistent deficits in exercise capacity. I think those with long haulers, the number is about 28% had microthrombi. And the results suggest patients with long COVID should be screened for impaired exercise capacity and markers associated with blood clotting. Hyperferritinemia is another blood marker, or is a blood marker that would be indicative of long COVID. So many people ask, how does COVID or how does long COVID exhaust the body? Well, there are 4 factors that increase the risk in immune system dysfunction. Number one, if you're in a room with 500 people and 100 have COVID, you'll probably have a higher level of viral RNA during the infection versus if you're in a room with 500 people and you get exposed to 1 that has COVID. So the amount, the viral load always depict the damage to your immune system. The presence of certain autoantibodies. So if you have autoantibodies, if you have a susceptibility to autoimmunity, or you have a real serious case of COVID, you're going to produce these autoantibodies. Reactivation of Epstein-Barr is also an indication of a dysfunctional immune system. Having type 2 diabetes, long COVID patients have a disrupted immune system. And here's a huge takeaway. Viral genetic material remain embedded in the intestines and lymph nodes. So you still have what we call a viral ghost or a viral reservoir. Circulatory systems, you'll have more microscopic blood clots, increased cytokines. Brain, without question, you'll have cognitive impairment and reduced amount of blood leading to chronic fatigue. I see a lot of chronic impairment. A little personal note, my mom caught COVID about 18 months ago. She's elderly. She's in her 90s, but immediately from the time she caught it till today, I've seen a tremendous decrease in her cognitivity. She doesn't call me by my name now, doesn't call me by my nickname. She doesn't remember my middle name. She goes through the list of people. I'm the youngest in the family. So yes, I know she may not be a great case study, but when it occurs personally to you and you get a vantage point like that, you realize what this can do and you want to start helping people and share the information with others. Cellular danger response. People say, well, why do we get fatigue? Well, what's going on? Well, everybody knows what a mitochondria is, and we all know mitochondria is the powerhouse of your cell, makes ATP. They have power plants, but our mitochondria's origins come from bacteria. Also, our mitochondria have a secondary function to help with the innate immune system. So the immune system drains a lot of energy from our body. It drains over 50%. Obviously, if you have COVID, your immune system is going to be on high alert. Your mitochondria will sense the the drain of energy and want to switch from going from primary from energy function to immune support. And now your immune system, excuse me, your energy producing system literally shuts down and goes to the immune system cell defense. They call that a cellular danger response, or a switch button that we have. That said, my question is, who really thought that in many instances your mitochondria would turn back on at 100% efficiency? And that's what you're seeing now. And that's why you're seeing the chronic fatigue. So again, as I told you before, long COVID and Epstein-Barr go together. About 2/3 of long COVID subjects were positive for Epstein-Barr reactivation. The conclusion was many long COVID symptoms may not be a direct result of SARS-CoV-2 virus, but a result of COVID-19 inflammation-induced Epstein-Barr virus reactivation. Is it one or the other? It's probably both together. So long COVID leads to disrupted sleep, and fatigue comes months after infection. 41.3% of patients reported at least moderate sleep disturbances. 2/3 again report moderate fatigue. Anxiety is linked to long COVID sleep disruption. You know, what's most interesting about this, and I want to, this alluded to, but I really want to go into detail. Obviously, sleep's a problem. Obviously, fatigue is number one, as I said before. But what I'm seeing is it doesn't always, these symptomologies don't always follow immediately after COVID. It can come a month or two later. So most people think you're on this trajectory. You know, you get COVID and then you're not feeling well, et cetera, et cetera. You may feel okay and still long haul. So many people have called me up and said, I'm doing okay with the newer variant. I'm just concerned about long haul. So let's look at some biological changes of people with post-COVID. Disturbances in the circulatory function, destruction of the ACE2 enzyme that is a receptor for the virus, ongoing state of inflammation in the body, immune system typically not returning to pre-COVID state, abnormality in T cell function, high rate of autoantibody function, mitochondrial distress and dysfunction, and the gut microbiome. That may be first. COVID causes a loss of diversity in your gut, a loss of anti-inflammatory organisms, an increase in inflammatory organisms, and an increase in leaky gut occurrence. 80% of your immune cells are in your gut. Your virus gets shedded through your nose and your mouth in this particular variant. And in addition to that, it gets shedded through your gut and it can damage your gut. And if you have a leaky gut, and we'll talk about gut before we get off, imagine that. Imagine you have to have a leaky gut and the virus is trying to be shedded, and you can go through, get through your leaky gut, if you will, and cause hyperinflammation. Some newer definitions, subacute or ongoing COVID, post-COVID-19 syndrome, it's now up to 12 weeks. Long COVID, long hauler syndrome, it really should be long haul syndrome, there's no S anymore. Chronic ongoing COVID symptoms beyond 12 weeks from acute infection. Post-acute sequelae of COVID-19, symptoms persisting beyond the 4-week period of acute infection. So now I told you the problem. We spent about 27 minutes. I just looked at my clock. Do we have a better answer? And I believe we have a resounding yes. I believe, and I concur wholeheartedly with this statement, nutrition could play a key role in the management of post-COVID-19 syndrome, all of those, long haul syndrome, long COVID, post-acute sequelae COVID-19, etc. Some of the things that a lot of patients have complained about is the anatomy of and the loss of taste and smell. The reason of loss of sense of smell is the olfactory bulbs typically swell, and there's also damage to the taste bud. Most people have a loss of sense of smell and taste, but some people just have a loss of sense of smell. Taste and smell, what you'll see is interleukin-6 correlates dramatically, as interleukin-6, which is a key inflammatory marker, is shown to increase your loss of taste and smell, also goes parallel with that. JFK made a statement, a quote, which I like to utilize often. The time to repair the roof is when the sun is shining. And I think what he made real clearly and simply states is he believes in being proactive as opposed to reactive. And we in America, in health, and we all know that, on these webinars and being in functional medicine, functional neurology, that too many times Americans, Canadians, etc., North Americans wait to respond. I'm a big believer in not waiting, but acting before. So the idea, and I thank Dr. Jeffrey Bland from Big Bold Health for allowing me to use the slide, immune support versus immune rejuvenation. You really don't want to support your immune system if it isn't functioning. Why would you support a seesaw that's imbalanced? The same thing with your immune system. You want to rebalance. You want to fix your immune system, or the term that I like to use is immunorejuvenation. Reprogram your immune system, leading to improved balance and resilience. If you can get immunorejuvenation, then you can support your immune system. So there are a few ways and a few supplements and a few vitamins that I recommend wholeheartedly to allow to rebalance your immune system. And let's look at them. Let's look at them from the aspect of helping your innate immune system and your adaptive immune system. Now, all of these nutrients, these vitamins and minerals and nutrients are pleiotropic because they all work with both the adaptive and innate immune system. Vitamin A, which has a lot of health promoting salubrious properties. Vitamin C, vitamin D for the innate immune system, zinc, and omega-3. That said, look at the adaptive immune system. You've got vitamin A, vitamin C, vitamin D, zinc, and omega-3 fatty acids, most predominantly pro-resolving mediators. So just to rebalance, you're not looking at 15 different bottles. You're not looking at a whole bunch of things. You're looking at simply vitamin A, vitamin C, vitamin D3, zinc, omega-3 fatty acids, and probably pro-resolving mediators. Now, pro-resolving mediators, everybody knows what vitamin A does, C, D, zinc, and even omega-3s. Everybody's very familiar. Pro-resolving mediators are the new kid on the block. They allow for the resolution of inflammation. They allow for the homeostasis between the initiation and the resolution of inflammation, and have shown to put the brakes on autoimmunity in the adaptive immune system. So this is a litany. It's not a full list, but it is a list of some immune support supplements. Vitamin C, zinc, mixed mushroom complex, vitamin D3 with K2, probiotics, multivitamin, multimineral, PEA, NAC or liposomal glutathione, selenium, omega-3 fatty acids, pro-resolving mediators, and vitamin A. Omicron. Omicron was discovered in South Africa. It is a variant. It is the predominant variant right now. It's vastly different than the Gamma and the Alpha variants in that they were attacking the lung. They seem to be much more damaging to people's overall health. The Omicron is with the bronchi or the bronchius, so it's a little different and affects the trachea. One study that I like to share with everybody, I kind of think vitamin D is everybody's jumped all over it now because of these great studies. Here's the takeaway. Population studies, 7 clinical studies found that vitamin D levels were linked to COVID-19 mortality risk if you had 50 or higher. Here's the skinny on this. Bottom line, your takeaway, your clinical gem. If you had over 50 in a level in vitamin D, nobody died in any of the studies. And I don't think there's anything else I need to say. Let's all get our vitamin D levels up. Let's get them, they're critical, and let's get our vitamin mineral levels up to an appropriate level. Hippocrates, 2,500 years ago, said, all disease begins in the gut. Alessio Fasano said in 2000, all disease begins in the leaky gut. So here's my Dr. Rob's Gut Matrix. It was something that we wanted to talk about and we want to take a couple of minutes. Many people know how important gut is. We're going to save at least 12 minutes for questions at the very end. So let's dig in to this. So 80% of your immune cells are in your gut. It's where your macro and micronutrients are absorbed. I believe that the gut is the epicenter of your health. I think it starts and can end there. Your gut affects all different systems. And let's just talk about the gut in general, in that when I say the gut, what do I mean? Well, I mean the small and the large intestine. The small intestine really is a misnomer. It's not small, it's small in diameter. It's about an inch. The large intestine is about 2.5 inches or 2.5 times larger in diameter than the small intestine. Your small intestine is about 95% of the length of your intestines. It averages anywhere from 20 to 52 feet in humans on an average of about 22 feet. If you would unravel your small intestine, it would have a surface area of anywhere from a tennis to a basketball court. Your small intestine has a layer, a thin layer. It's a single layer epithelial cell that has the thickness of a wet paper towels, whose sole purpose is to allow small digested food particles to go through, water, and vitamins and minerals. And on occasion, some antigens and what are possible pathogens, possible bacteria, viruses, and the like, to allow the tight junctions just to open a little bit, just so the immune system can test and see what's going on. Whereas your large intestine has the bulk of the bacteria and it's used there more for elimination. What's going on in your gut, or what can be damaging to your gut? Well, food sensitivities. I believe everybody should take a food sensitivity test, especially in these times, because if you've damaged your gut, you can have a food sensitivity. If you have a food sensitivity, you can damage your gut. Food sensitivities are fascinating to me in that typically from ingestion to symptomology, it can have a 72-hour lag. So most people don't know they're sensitive to foods. They will know if they're allergic to foods because they'll get a reaction, and usually a very gnarly reaction within an hour. Of course, we're looking at leaky gut. The idea of leaky gut can also be exacerbated by yeast, fungus, or overgrowth like candida. It's not a gut seminar. I'm sure everybody all knows that. And dysbiosis. Dysbiosis is interesting because when I ask attendees at many of my seminars, what's the definition of dysbiosis? Believe it or not, good and bad bacteria, unleveling of good and bad bacteria. You need 85.1% approximately good bacteria not to have dysbiosis. Now, your gut is bidirectional with your liver. Whatever you do to your gut, you do to your liver. When there's toxics and chemical overloads, you can have liver dysfunction. When you have liver dysfunction, you can also have gut dysfunction. So many people have asked me, and I will share my 7R program, what happens first, the gut or the liver? I usually attack them both together. If you have leaky gut, you have a higher incidence of blood sugar problems, insulin resistance, and insulin. Body composition also fails when you have leaky gut. Also, a higher incidence of autoimmunity, especially a great example of that is thyroid issues. And I am a chiropractor, so I do see musculoskeletal injuries. When you have leaky gut, you have an increased release of cytokines. Those cytokines lead you down a path of arthritis and joint pain, and also an excessive amount of release with leaky gut of MMPs, matrix metalloproteinases, your body's own proteolytic enzymes that are released at the time of injury that chew up soft tissue injury, or I should say fibrocartilage like disc. So leaky gut, we now have a gut to disc axis, a gut to joint axis, a gut to skin axis, and the superhighway to health is your gut to brain axis. Whatever you do to your gut, you do to your brain. Whatever you do to your brain, you do to your gut. So leaky gut, leaky brain, increased inflammatory neurodegeneration. Your gut speaks to your brain in a millisecond. So defective epithelial barriers can be linked to a myriad of chronic issues. So defective epithelial barriers are linked to a rise in almost 2 billion allergic, autoimmune, food sensitivities, neurodegenerative, and psychiatric different diseases. So here's a PowerPoint that I'm hopefully it becomes very evocative for everybody, how diet and lifestyle contribute to inflammation amongst your patients. Number one, you've got antigens and toxins in the gut. You've got GALT and MALT. So you've got MALT, mucosal associated lymphoid tissue, and you have GALT, which is gut associated lymphoid tissue. Your toxins and antigens, if they go through your small to your large intestines and don't get through the proverbial leaky gut, life is copacetic. However, antigens and toxins will trigger inflammation in the GI tract. They may burrow their way through the mucosal lining. When they burrow their way like that one antigen just did, what you'll see is a Th dominant resulting in a heightened inflammatory response. You'll have B and T cells attack that antigen. You will have a localized inflammatory response. If you're overwrought with antigens through your leaky gut, if you will, you may not just have a localized inflammatory response, you may have a systemic inflammatory response. And going back to what we talked about in molecular mimicry, you may have an autoimmune response. So your goal for yourself, your friends, your family, and your patients is to keep your gut in its pristine condition. So immune cells activate an inflammatory response. So your cytokines, which get released because immune cells identify antigen, you have interleukin 1 and interleukin 6, interleukin 1 beta. Again, interleukin 6, if you wanted to do one interleukin, that would be the guy. So these cytokines are released. Now, when you have a cytokine storm, if they don't slow down, cytokines look for help. They actually want to recruit more immune cells. So the more cytokines produced, obviously the more inflammation, those cytokines will ultimately produce TNF alpha, and you're really having this cascade. And in that cascade, everybody, those patients, you are on fire from the inside out of your body. So let's take a look at this, compare and contrast the left side versus the right side. The left side, the tight junctions, and they should be tight, are in place, and your microvilli, those finger-like projections, which are microvilli, which actually have digestive enzymes in them. They're called microvilli because they look like shaggy carpet in Latin. All are working to keep everything inside your gut and dispense with anything that shouldn't be there through your large intestine. However, when your gut becomes leaky and inflamed, these particular microorganisms, or toxins, if you will, are able to burrow their way and get through the mucosal membrane cells, get into your bloodstream. When they get in your bloodstream, your B and T cells will react, and you'll release IgG, IgA, and IgM, leading you down a path of nutrient malabsorption, autoimmunity, food intolerances, blood-brain barrier breaches, and systemic inflammation. And in those food intolerances, you're also going to have food allergies and most predominantly food sensitivities. So take care of your gut. It's a critical organ in your body. So how does COVID-19 cause GI symptoms? Well, the virus enters intestinal cells using the ACE2 as a receptor. FYI, there's 100 times more ACE2 receptors in your gut than in your lungs. The spike protein binds to ACE2 receptors, triggers cells to release cytokines, increases inflammation in the GI area and your symptomology. COVID changes your microbiota. And one of the things that people forget, that the virus gets past fecal oral transmission. It can cause viral shedding through the poop, if you will. Here's a takeaway for all those people who question if they want to test gut barrier permeability in this day and age with just general overall health or post-COVID-19 complications. It was shown that people who had excessive inflammation had excessive gut permeability because COVID increased tight junction permeability. There was a steep increase in zonulin. Zonulin is the actual pressure on the epithelial cell. Zonulin was a marker for higher mortality in severe COVID, according to the study. LPS, lipopolysaccharide, which holds gram-negative bacteria in the inside of your gut, when expressed through the gut, becomes an endotoxin and can damage organ systems. And occluden's also elevated. So a lot of people ask me at the gut level, what did I just say? So here is your gut. See, nice and tight. There's your tight junctions. My interlocking of the fingers is a tight junction. Zonulin pulls on them and allows for a diametric pull. So it is a functional pull. Occludin is structural damage. And LPS, if it's released through the inside of the gut, really speaks to the idea of an endotoxin. So COVID in this study really showed a lot of damage to the tight junctions. This slide piggybacks on the previous slide in that with the loss of tight junctions, you saw a hyperinflammability response in the body, because if you had a leaky gut and the virus went through, you could, in theory, I won't say reinfect yourself, but cause yourself hyperinflammable status because of your gut being too leaky. COVID had an interesting impact on the GI. This is sort of a review of what we said. It caused loss of diversity, loss of beneficial bacteria, expansion of pro-inflammatory bacteria, expansion of yeast, and a higher incidence of leaky gut. Post-acute COVID-19 syndrome and gut dysbiosis lingered beyond a year after the SARS-CoV-2 clearance. So It could have been 6 months, 8 months, 9 months ago, a year ago. You still may want to check gut barrier permeability. Real brevity on the gut to lung connection. So the gut and the lung are intertwined. So essentially in this slide, you'll see the brain, lungs, gut microbiome axis in COVID-19. The microbiota communicates with the gut, and the gut communicates with the brain, and there's a little intermediary in between the brain and the gut called the lungs. Just to really take that to the next step forward, the gut to lung communication, the gut speaks to the lung via environmental products, bacteria, bacterial fragments, short-chain fatty acids, the big player there would be butyrate, immune cells, and signals via the vagus afferent innervation. For me, the vagus nerve is the key component to the communication of the superhighway to health. That vagus nerve goes from the medulla oblongata, again, through the transverse colon. It attaches to the transverse colon. It attaches to something that's called a neuropod on the transverse colon. That neuropod is able to sense what's going on inside the microbiota, inside the gut, communicate with the vagus nerve. That's how the microbiota and the gut actually are synced in a sensory form. The vagus nerve then communicates with the brain. It's afferent, 80 to 90% afferent, 10 to 20% efferent. So the gut, the lung has a direct communication. And interestingly enough, the bottom portion of the lung has exactly the same kind of microbiome as the gut. So when you've got pulmonary dysbiosis, you have gut dysbiosis. When you have gut dysbiosis and you've got leaky gut, you have a translocation of that bad bacteria, and it adversely affects the lower lung region. So vagus nerve stimulation, something I do in my office a lot, really is a critical element to the gut to lung action. Its effective strategy, vagus nerve stimulation, allows you to protect against acute lung injury. The protective effects of vagus nerve stimulation to prevent acute lung are critical elements to the overall health. So there's a few different ways to stimulate the vagus nerve. One of the ways I use low-level laser. There's physiological size. There's nutritional components. Everybody wants to be able to have a balance in your vagus nerve because it's a captain of the ship of the parasympathetic nervous system. When your sympathetic and parasympathetic systems are balanced, your autonomic nervous system is in balance and working efficiently. We all know that we don't treat symptoms in the idea of functional nutrition or functional medicine. It's all about the sync or the interconnection of the sync of the systems. There's only 12 to 14 systems. And to take it to the next step in our theory, we all look at root cause resolution as opposed to just, blocking the symptom. So let's look at the last axis I'm going to talk about, which is the gut to brain axis. Let's get to the root cause of the broken brain. I can see that there are questions. I will save at least 8 to 10 minutes for questions. Something I like to say often, gut on fire means brain on fire. Whatever you do to your gut, you do to your brain. Whatever you do to your brain, you do to your gut. Do you get gas and bloating after you eat? Do you 45 minutes after you eat, do you get brain fog? Well, getting gas and bloating implies that you have something wrong with your digestive tract and or your gut, which obviously is part of your digestive tract, but you have no pain. You get gas and bloating because you have no pain fibers in your gut. It's the only symptomology your body can share with you. If you get brain fog 45 minutes after you eat, you may have a compromise of what we call the blood-brain barrier. Within all that, the reason that you get that lethargy, brain fog, is simply because the nerve conduction from your gut to the brain is dimmed. There's no pain receptors in your brain, and that's why you get this symptomology. So let's look inside the blood-brain barrier, which I wanted to mention will be one of my first protocols. You get few autoreactive antibodies on the left. You get no damage to the astrocytes, which are structural end feeding that support the blood-brain barrier, and no neuron or no damage. So even if you have autoreactive antibodies, if it doesn't get through the blood-brain barrier is like your gut barrier. It also filters 400 miles of blood in your body, arteries in your body, and it also encapsulates virtually all of the brain except for the pituitary gland. If you compare the left side to the right side, you have few autoreactive antibodies. However, they're able to slip through because of disrupted tight junction. You get slightly damaged astrocytes, and you get minor damage to the neurons. Now, something called brain neurogenesis or neuroplasticity from brain neurogenesis can occur as long as the neuron isn't dead, which means that nerves can rewire together because they are firing together. Unfortunately, before that happens, and what I just depicted, your brain may just be simply out of order. So let's go through my 7R action plan. Let's take a minute or two with that. My reset plan, I want everybody to reset their diet by obviously get off the standard American diet, get a keto diet, get a Mediterranean diet, live a healthy lifestyle. You know, Jim Rohn once said, take care of your body. It's the only place you have to live. Nothing's ever been more true than that statement right now. Change that mindset. So get your sugar out, get your gluten out, get your dairy out, test for food sensitivities, get into my second R, remove unwanted pathogens. Those pathogens are toxins where you would do a liver detoxification, taking food sensitivities out, oregano oil, berberine, garlic, serum bovine immunoglobulin, all are great at removing unwanted pathogens. Your third R, replace. Replace needed digestive enzymes, stomach acids, pancreatic enzymes, and increase bile flow. 60 to 70% of Americans have a digestion problem. Regenerate. Heal and seal your gut lining. Create a microenvironment in the gut. This is where you pick from your plethora of different nutrients to allow for, again, that healing of the gut wall and the creating an anti-inflammatory microenvironment inside. You then would want to take step 5 of my 7R action plan and use quality pre and probiotics. Prebiotics like fiber would feed a probiotic, which leaves a postbiotic like a short chain fatty acid or the residual of the process. You really want to take the pre with the pro because you want to feed those probiotics. Step 6 is reintroduce. Reintroduce the foods in step 2 that you removed. Food sensitivities does not mean you don't eat that food for perpetuity. It means you take them away, retest, and see if by fixing your gut permeability, those foods are now not damaging or lighting up your immune system. And lastly, retain your health and your GI integrity. You didn't want to go through this whole process to go eat Domino's. You didn't want to go through this whole process to go eat Ben and Jerry's ice cream. Brain supplements for blood-brain barrier, neuroplasticity, fish oils, turmeric, pro-resolving mediators, magnesium L-threonate, L-glutathione, the most abundant, the master antioxidant. Medium chain triglyceride oil is great for any kind of brain function. Taurine. Taurine's great for bile flow. Taurine also inhibits excitotoxicity in the brain. It closes the synaptic cleft. Pre and probiotics are critical for overall gut health. Fermented foods would be great within that realm. Resveratrol is also an outstanding choice. Ketone bodies. Ketones give the brain phenomenal energy. Your brain works much better on fat and ketones than it does on carbohydrates. Fat and ketones are a clean fuel. Carbs are fatty fuel. And for me, the data is robust. Low-level A's is a great choice for brain, blood-brain barrier, and increased neuroplasticity. So let's close it with, we talked about the idea of you can't control the virus, but you can control the host. How can you control your host? Well, number one, avoid certain foods. Here are my acronyms: GPS, no gluten, no processed food, no sugar. DNA, no dairy, no nicotine, no artificial sweeteners. Follow an anti-inflammatory diet. You know, obviously, fried foods or deep fried foods pose an issue. Foods that light you up, like food sensitivities, etc. Control your glycemic load and your glycemic index. Keep your blood sugar markers low. Detect or avoid any kind of food sensitivity and limit and minimize your environmental overload. Make clean eating a priority. Organic or farm to table type foods. Eat wild smash fish, smash, salmon, mackerel, anchovy, sardines, herring. Eat a plant-based diet. Tom Brady may have it. 80% plant-based, 20% protein, not bad. Consume low glycemic index fruits and eat from the cornucopia, if you will, of choices of vegetables. Use grass-fed meats. High fiber. Choose raw nuts and seeds. Chicken soup and bone broth are great choices. Great snack is an organic dark chocolate. Have a little piece every day. When I say a piece, I don't mean a whole bar, I mean a piece. Herbs like ginger and turmeric are very anti-inflammatory. Get enough water, hydrate. If you're going to drink coffee and tea, and I'm a big organic coffee guy, go for it, but make sure they're organic variety. Cooking oils, make sure they're extra virgin olive oil, coconut, avocado, macadamia nuts. Avoid vegetable oils. There are no vegetables in vegetable oils. And eat as many mushrooms as you can, especially raw, if you will. High polyphenol diet has health promoting impact on the gut. And if you're suffering from any kind of diarrhea, which we talked about, B. subtilis, Bacillus subtilis has shown to be a great anti-diarrhea probiotic. Lastly, let's go through some lifestyle hacks or lifestyle tips, if you will. Consider a time restrictive eating, intermittent fast. Fast for 12 to 16 hours. Intermittent fasting provides autophagy. It's a breakdown of old cells, and using that debris, you make new cells. That leads you down a path of immunorejuvenation. Time restrictive eating, intermittent fasting also allows for mitophagy, the breakdown of old mitochondria to new mitochondria. And we realize how important efficient mitochondria is, especially post-COVID. Get sufficient sleep. It's where your body rejuvenates itself. It's where your body responds. It heals. 7 to 8 good quality hours of sleep. It doesn't have to be a home exercise plan. Get an exercise plan, get moving, get your steps up, do some resistance, do some flexibility. 15 minutes is enough. If you can do 45, even better. I'm a chiropractor. I'm always going to purport that chiropractic care is a great alternative to a lot of the other things, and it goes in synergy with all different kinds of medical approaches. Low-level laser, we've talked about it before. I believe in you modifying stress, balance, support, rejuvenate your immune system. And I just want to piggyback on what I said earlier about people who practice intermittent fasting experience less severe complications from COVID-19. Lastly, before I get into a couple of the quotes, and then we open it up for questions, instead of reacting to a disease, why don't we become more proactive? Again, proactive versus reactive. Vincent van Gogh said, your profession is not what brings home your weekly paycheck. Your profession is what you're put here on earth to do, with such passion and such intensity that it becomes spiritual in calling. So I've got a book coming out. I think we mentioned it at the beginning. It's called Immune Reboot, Your Guide to Maximizing Immunity, Restoring Gut Health, and Optimizing Vitality. Immune Reboot, this is like a synopsis of the book. Immune Reboot is a compilation of the last 2.5 years of all the learning, all the incidences with patients where we show you about immune system. We share specific protocols in immune system for today and things that have occurred during COVID-19. The foreword was written by Dr. Jeffrey Bland. It's going to be out. We're going to get the exact date in about 24 hours. I wish we would have had it today, but sometime at the end of October, at the beginning of November 2022. Anybody that has any questions, that's how you can contact me. I left just a couple of quick minutes for questions. I'll stay. Let's go for it.
Awesome. Thanks so much. Yeah, thanks so much for that really great presentation. So like you said, we have a few minutes left and a couple of questions came in, so we can power through those now. How long after COVID infection will blood work be elevated, assuming CBC with differential?
That's a great question. It appears anywhere from 2 to 4 weeks that they're finding it.
Perfect.
That is an excellent question. Really, most people don't do any blood markers in reference to COVID. They just take the test and go on. And I guess at this point, that's kind of understandable with a little bit of the fatigue. But from a practitioner's viewpoint, you do want to pull the blood because you want to see who's susceptible to the long haulers and put them on any program or strategies that you need. The blood tests allow you to stratify what's going on in the patient.
Thank you. So the next question is, should we treat the Epstein-Barr virus, or will treating long COVID address the reactivated EBV?
That's another excellent question. So within the long COVID or long hauler protocols, you should be addressing mitochondrial reactivation and decreasing fatigue. So obviously you have a similarity with Epstein-Barr. So I think you're getting the two together. And, for instance, mushrooms, et cetera, you're going to do both of them together. So you don't have to separate them. And, my protocols are extensive. And unfortunately, the patient needs it because they're in they're running on empty.
Awesome, thank you. And then we have time for one more question here. So this question says, when you have a patient with long COVID symptoms, what labs do you typically run first?
Well, I will definitely run the Epstein-Barr. I will run a typical inflammatory ANA, C-reactive protein, interleukin-6, and shocking as it may seem, I run a lot of gut barrier panels because what I found in my office, if they have a leaky gut, they're not going to respond as quick, and I want to patch that gut up as quickly as I can. So those are the composite, and I'm sorry, I missed one. You want to run a full blood chemistry on any kind of the blood sugars and insulin markers because of that rise in diabetes.
Great, thank you. So we know that everybody's time is super valuable, so we're going to wrap up this presentation by thanking you again, Dr. Silverman, for being here with us today, and we truly appreciate all of the attendees taking time to join us as well. Just one more quick reminder that you will receive a copy of this recording as well as the slides in your inbox in the coming days, and you can also find our webinars on fullscript.com/webinars. So thank you everyone once again, and we can't wait to see you next time.